As you understand, ladies and gentlemen, it is imperative for advancing global health that members of parliament and governments across the globe have the level of understanding and awareness as presented. However, without an active and broad civil engagement, action might be hindered. It is a delight to present Yashodhara Dasgupta, Vice Chair of the Commission, to address the role of civil society in global governance for health. Please, Mrs. Dasgupta.
Good afternoon, friends, and thank you very much for this opportunity to address you on some of the key issues surrounding the work of our Commission. You have heard governments, you have heard the university, and I'm taking you now into a very local part of India, not at the global level, but to try and make the links from the local to the global. What the Commission said is that there are some groups of people towards whom there is an inequitable attention regarding their well-being and their rights. And it's talked about public health, and I'm sure you all agree that public health is not merely the absence of disease, but it also relates to the social determinants of health, to well-being, safe water, food, and so forth. And the report has very bravely talked about the power dynamics and disparities. It has really confronted some of the sources of inequity that prevent health decision-making in favor of all the people of the world. So I would like to take you now into some of the sectors within India where civil society has been working, and to bring you some of these stories for you to decide how civil society can play a role in global governance for health. So first of all, we need to look at this vegetable, which I believe is called the eggplant. In Norway, we call it the brinjal. And one of the US agribusiness companies brought this into India as a transgenic hybrid and asked the government to introduce it into the commercial sector. On the other hand, the farmers in India were perfectly happy with the amount of eggplant that they were producing and really had no desire to get an improved transgenic variety. So we have civil society activists who left their jobs in different countries of the world to come back and put in litigation into the Supreme Court of India, saying that the research that the company had produced was actually based on conflict of interest, and saying that there was not enough transparency about the regulatory mechanism. And finally, the government of India had a National Biodiversity Authority, which then sued the company for biopiracy. We find that there were movements of farmers. Here are farm women presenting their own local varieties of the vegetable and saying that they didn't need a transgenic hybrid. We have the youth from civil society, the students, saying that they did not want to become lab rats, experimental beings. And we had a very strong declaration that this was a kind of bioterrorism within India. What did the scientists do? Well, some of the scientists, I'm sorry to say, were actually quite clear that there was no harm involved. Despite insufficient evidence, they signed on saying that this was perfectly all right and it could be introduced in India. But the kind of debates that this gave rise to led to national media attention. And finally, there was really a countrywide debate about whether we should be afraid of transgenic hybrids. The Minister for Environment at that time held an unprecedented series of consultations all across the country, meeting thousands of farmers, activists, scientists, and many others who spoke on both sides of the spectrum, and finally took a decision in February 2010 saying that there would be an indefinite moratorium on the introduction of the transgenic hybrid crop of eggplant until there was enough scientific evidence that could put to rest public concerns regarding its safety. I take you now to eastern India, to the village in the forests of Orissa. And here we have the hill, the Niyamgiri hill, at the foot of which you can see a very peaceful settlement of the Dongriya Kond tribals. And these indigenous people live in perfect harmony with nature. And here is the mountain which gives them fresh water, which gives them the fuel, the housing material, and the food that they need for their own healthy and sustainable lifestyle. And they worshiped the mountain unsurprisingly. They led their peaceful lives. But all of a sudden, there was a very large mining company from the UK which decided it needed the bauxite that was available in that area. Well, we can rest assured that the company was very concerned about the environment. As you see, they say, let's create a better tomorrow, let's preserve nature today. Unfortunately, when they wanted to come in for their bauxite mining, these hills and this fresh water was put to severe threat. And this is what the mountain began to look like once they began their operations. So the tribals took a stand and they said, the company cannot take our mountain. The message was quite clear, that we do not want the company in this country, we do not need the kind of factories and the kind of production that will put our environment at threat. And there are several films on this particular struggle which you can access on the internet. And in one of the films, one of the tribal youth says, we cannot live without the mountain. We need the mountain, and the mountain needs us. In a very simple way, I think he got across the fact that the environment needs all of us to be concerned about it, to preserve it. It's not just that we need it for our sustainable lifestyle, but the environment needs us to stand up for it as well. And so the tribals stood up and they asked for their rights. There was strong police oppression. The company did not really keep any tactics aside in trying to suppress the revolt of the tribals. And there was solidarity. I'm proud to say that all across the globe, there was solidarity with this small group of less than 10,000 tribals. As you can see, there are people in London who asked the Financial Control Authority to delist this particular company. And there were people in New York demonstrating outside the UN saying that we need to stand in solidarity with these tribals. In an unprecedented move, once again, the Supreme Court of India actually called for an environmental referendum. And so all the 12 villages that were affected by this particular mining company were asked to vote on whether they wanted it in that area or not. The company, of course, promised jobs to everybody. It brought in the police on the day of the voting, but the tribals stood firm. And luckily, all the villages voted unanimously, and the mountain was saved. Finally, I take you into a city in the heart of India, which is Bhopal in Madhya Pradesh, and I'm going to give you the story of 30 years of unending pain of the poor people of an urban slum in the center of the city. This is a scene frozen in time from the 3rd of December, 1984. This is the ruin of a factory that was constructed there to produce toxic chemicals that were to be used for the production of pesticides, for which there was a burgeoning market in India at that time. The toxic chemicals that were produced slowly led to less and less demand, and the factory was shut down. Unfortunately, the company did not put in place the safety regulations that were needed on the grounds of cutting costs. And so the factory was not safe on the night of the 3rd of December, 1984, when there was a massive leak in the tanks and a deadly cocktail of poisonous gases went out into the communities next to the factory. You may ask, why were there communities next to a factory producing toxic chemicals? It's a good question, because it shows that governments and companies do not always take decisions that are completely in favor of the health of the people. The company needed to be in the center of the city because of their transportation needs, and so it was next to the railway yard, and the railway lines are where the urban slums, where the poorest of the poor settled. And so the gases leaked out, and women and children who were asleep on that night finally had to rush to hospital. They were blinded. They could not breathe. Women were aborting on the streets. And finally, there were so many bodies that the hospitals couldn't even count them. Thousands died. No one really knows how many, because they had to be mass cremations. It was a public health issue. They could not have the bodies rotting in the yard. And so bodies were thrown into the river. They were dumped in mass graves, and they were cremated, as you can see. The person who was accountable was the person who flew into India the next day, and after a day, was escorted in safety back to the airport to fly back to America, never to face criminal charges in India for the death of tens of thousands of poor people in this city. It became a global issue, as you can see from the Time magazine at that time, and yet the citizens of the world have allowed this injustice to persist for 30 years, and he has not been brought to justice. The poor of those urban slums continue to struggle, but there is no international criminal court that can actually take up this issue because courts only adjudicate between the nation states, as we just heard. The nation states are supreme, and there is no one really who can look at what transnational corporations are doing to the people. The groundwater around the plant is now contaminated by those untreated and undisposed of toxic wastes. And so the children who were born after the gas leak in the last 30 years are now coming out with congenital deformities. Every government that has come into power has betrayed the people, no matter what their color and what their tinge. And the struggle continues, not just for health, but also for justice. So the question remains, what about civil society? We are here as civil society. We are researchers, we are students, we are people who work with NGOs. But what about uncivil society, the poor, the invisible, those who are raising their voices, who are trying to convey their suffering? They cannot spell it in terms of the social determinants of health, but they are talking about their rights to safe water, to safe food, and to a safe environment where they may breathe freely without fear of illness. So those of us who have the privileged positions in the world, those of us who are in countries that have the resources, that produce the knowledge, have to know where we stand and whether we are listening to those voices. I end with a call for solidarity. Thank you.